So one of the most common questions I got in my sleep clinic today, where I was looking after children with sleep disorders, was what is obstructive sleep apnea and what are the signs and symptoms that we're looking for? So obstructive sleep apnea is where you have narrowing of the airway. So the airway is basically a tube that starts at the nose and it actually goes down all the way into the back of the oropharynx. It actually goes back into the windpipe, and then actually goes into the thorax as well. But essentially, that entire tube is the airway. And so in obstructive sleep apnea, there is obstruction or blockage or narrowing of that airway such that the diameter of that tube is reduced. So you have less diameter, you have resistance to airflow. And that can be because of stuff in the airway. So in children who I see who are in the preschool age, commonly we're seeing large tonsils or adenoids as the reason for that blockage. But stuff can also cause blockage in the airway if it's compressing on the airway from outside. So for example, if there's a lot of subcutaneous tissue that's sitting on the airway, that can actually block the airway. If there's low muscle tone, for example, in some of our children who have neuromuscular conditions like Duchenne muscular dystrophy, that can actually also affect the structure and the size and the caliber of the airway. So that's what obstruction of the airway is. And basically in obstructive sleep apnea, you're getting reduced airflow because of that blockage. And that airflow is either causing a drop in the oxygen level, or it's actually causing the brain to have a microscopic awakening from sleep. And so it ends up being called this thing called an arousal, where the person isn't fully waking up from sleep, but the brain is having a partial awakening. And it can even lead to the person fully waking up from sleep as well. So that's what we're seeing on a sleep study. The key symptoms that we're going to be looking for with obstructive sleep apnea is snoring. So snoring is that kind of musical sound that's developing on a breathing in when you have worsening airway narrowing. And then it's snoring plus other stuff. So it's going to be including symptoms like hearing the person stop breathing. So it could be like snore, snore, snore. Oh, now we can't hear anything. And then often that's followed by resuming of breathing. And that resuming of breathing can actually involve like a gasping breath. So like, or it can even sound like a choking breath. So that's kind of the typical pattern that you're going to hear. There can also be increased body movement during sleep. The person might be described as very restless during sleep. There could be a mess of all the blankets. In older people who have bed partners, some of that restlessness would also be noted. There can be increased sweating during sleep. The mouth could be open during sleep. It could be getting dry. In our children, there might be difficulty maintaining urinary continence during sleep. In older adults, there could be frequent visits to the bathroom. And one of the most important symptoms of obstructive sleep apnea is that generally their sleep is not refreshing. So despite getting enough sleep, the individual often actually feels unrefreshed. They feel like garbage in the morning. And in severe cases, there can even be morning headache. So this is the most common thing I get asked in my clinic. So in summary, obstructive sleep apnea, we're having airway narrowing. For all of us, our airways become more narrow during sleep, but it's a more extreme scenario of that narrowing plus drops in oxygen level or these microscopic arousals during sleep. And the typical symptoms are going to be snoring plus other stuff. So I hope that helps to better understand obstructive sleep apnea.